Hello, my name is Dr. Sheila Clonan. I'm a licensed psychologist in private practice with Educational Solutions CNY, and I'm here to talk to you today about understanding assessment and test scores. Today, in our conversation, I'd really like to focus on the context of school-based assessments, and in the context of those assessments, I'm hoping to help you understand the types of tests that are typically used. I want to talk about the scores, how we understand and interpret those scores, and then the kinds of tests that are typically used. So again, we'll be focusing on assessments used in schools with a larger focus on those tests that are given one-on-one for the purposes of disability identification. So typically for these purposes, school-based assessments consist of Criterion reference tests, NormReferenced Tests, and Standardized tests. For the most part, NormReferenced tests are going to be standardized. Criterion reference tests often, but not always, are standardized. And we'll talk about that and break that down. The kinds of tests that we're going to be talking about are listed at the bottom of the screen here. We're going to talk about aptitude tests, achievement tests, specialized content area tests, and social-emotional, behavioral, and neuropsychological tests. Don't worry about that now. We're going to break it all down one by one. But the first thing I want to talk about is, what does this term standardize mean in the context of school-based assessment? It's important for us to understand that what it means is that it has a very prescribed protocol. So the examiner has scripted ways of asking students questions, and it's even scripted as to how much or whether or not they can ask follow-up questions for a student. So there's not rephrasing or sort of prompting the student to help. There's usually simple questions like, could you tell me more? And even that is not always allowed. And so that's very scripted by the test developers. And although that may sound kind of constrained, there's a reason for that. And the reason is so that when the tests are given to students across the country, they're administered, scored, and interpreted in the same way for all test takers. And in that way, we can compare students' performance across the test, no matter who gave them the test. So, and that'll become important when we talk about how these tests are scored. We can look at student A in District B and student C in District D and compare their performance, or compare their performance across the country. So that's why tests tend to be standardized. We are going to focus in today's conversation mostly about tests that are administered individually or in a one-on-one setting. So the different kinds of tests that we're going to talk about, as I mentioned earlier, one of them is Criterion referenced. A Criterion reference test measures student performance against a specific or fixed criteria. So they often have a passing score or a cut score or a proficiency score. And they measure acquisition of skills in a specific content area, so they're very narrow band. And students are compared to that performance standard. So one of the simplest examples is a classroom-based test. Okay, we're not going to be spending a lot of time today talking about classroom-based tests because they're quite easy to interpret, to understand. If a student gets a 97% on the test, we know that they performed well on 97% of the material of that test, right? But for Criterion reference tests that are used in assessments for disability determination, we're thinking a little more specifically. So some examples of that, and the little car in there is to prompt me to remember that a driver's test is actually a Criterion reference test, right? So when you go to take your driver's test, there are a set of criteria that the instructor judges you to have either passed or failed. And then there's a certain number of criteria that you have to pass your test. And so, you know, some of you may have had the experience of teaching a child to drive or teaching yourself to drive, and maybe you could do everything but not the parallel park. So you may not pass the test because you couldn't pass the parallel park criterion. Other examples of Criterion reference tests are the state tests, the high-stakes state tests that a lot of states give. The scores result in sort of, you know, passing, proficient, and mastery, right? So not passing, proficient, and mastery. So whether or not you are proficient in that material depends on how much of it you were able to show that you knew. Teacher-made tests, as I alluded to in the previous slide, are also an example of a criterion reference test. Advanced placement exams, AP exams, are scored, you get a certain amount of that right, and there's a cut point at which you've passed the exam. There's a higher cut point for even doing better. So criterion reference tests are actually used a little bit less in assessments for disability eligibility, but they absolutely have a place. For example, some of the standard or the criterion reference tests that I use in an assessment for learning disability might be something like the informal decoding inventory or quick phonics screener or the phonemic awareness screening test. So all of those are focused on a very specific content area, phonemic awareness, for example, and then you want to see how much of the material the student has mastered. So for example, in the informal decoding inventory, you're testing the student in each syllable type and you're saying, well, he only got 3 out of 10 correct on the consonant vowel consonant syllable type, and so there he's only 30% mastery, which means that systematic instruction is required. Or they might be at 50% mastery, so they need some review of that syllable pattern. So it gives you sort of cut scores, but it also gives you very specific information about what skills that student has and what skills they lack. So in that regard, it's useful for guiding instruction and observing mastery. It also can be useful for universal screening of students. So all of those are good things, and it might make you wonder, why do we use norm reference tests more in eligibility decisions? And the reason for that is that you can't really compare students across sort of different areas to say, well, this child had 30% mastery of this syllable type. What does that mean? How does that compare to other people his or her age? So standardized tests become important when we need to make those kinds of comparisons. And again, we don't always need to make those kinds of comparisons, but they do become important when we're trying to determine if a student's skills are so low that they qualify for classification as a student with a disability. So a norm reference test, the other kind of test that we use quite widely in school-based assessments or assessment for disability eligibility, are tests that measure student performance against a normative group. So these, as I've been saying, are most widely used in school-based assessments. They compare student performance to others on the same test, and they indicate the student's ranking relative to that group. So these are all things I'm going to break down and show you how that's done. A limitation to these tests is that the content is not necessarily specific to what the student has learned. The tests are based on kind of national standards of what we might expect, for example, a second grader to have learned, but different states and different districts might be doing things slightly differently. So there will be times when some of the content doesn't match things that the student has learned. But from an overall perspective, they do try to just sample what kids at that greater age level would know. And then the test, as I said before when we talked about standardized tests, is administered in a very standardized way. So an 8-year-old child is going to start at point A or B and continue on until they make enough errors that it's time to stop. So kids of the same age are administered roughly the same number or the same set of test items. So norm reference tests then are most useful for comparing student performance to a peer group. The peer group that they're being compared to is called the normative group, and we're going to break that down and talk about that in a minute. But essentially, we're able to compare whether the student performed the same, better, or worse than other students of his or her age or grade. So these tests, again, test kids on a similar set of knowledge, but doesn't give information specifically to what the student knows or doesn't know. It simply says, well, in terms of reading comprehension, his score falls below the average compared to other students his age. But we don't know, for example, without additional sort of testing or analyses of that student's results, what it was about comprehension that was hard for him. So that's an important limitation for you to be aware of. However, by comparing students to one another, it's possible to determine whether, how, and to what degree a particular student is ahead of or behind the normative group or behind other students his or her age. And when we're talking about determining whether or not a student has an educational disability, that of course is very important information. It's also a little bit more useful for seeing how a student progresses over time. Because, for example, in the example of a Criterion reference test, you can say, well, he didn't meet the criterion and now he does, but boy, should he have met that criterion 2 years ago? We don't know. But if you can say the child had a standardized score of 100 and then a year later his standardized score is 70, we know that there's a problem and that student hasn't made progress. So they do become more useful for looking at progress over time, although there has to be a large window of time in between administration of a standardized test. Examples of norm reference assessments would include things like the SAT, and then all the standardized tests of ability and achievement that are typically given in these school-based assessment, and then we're going to talk about those in a few minutes. So those are the types of tests typically given in school-based assessments. Now I want to talk about the types of scores that come from those tests, and this is where there does tend to be a lot of confusion amongst parents and sometimes teachers, because unless you've had courses in assessment and really had these things explained to you, they're not always intuitive. So it's really helpful for you as a teacher and an advocate for kids, or as a parent and an advocate for your child, to really understand both where these scores come from and what they mean, and how much we can interpret from them and what their limitations are. So going back to our Criterion reference test, again, the one that is admittedly used a little bit less in school-based assessments for these purposes, we typically have a pass-fail, a proficiency, or a percent mastery. I personally prefer the percent mastery, and so when you're doing school, tests like the ones that I mentioned earlier, things like the phonemic awareness screening test, informal decoding inventory, those kinds of tests, you can talk about percent mastery, and in that way it can be useful for looking at that student's performance over time. So he hasn't mastered this syllable pattern, we're going to focus instruction there. He's mastered it now, let's focus instruction on the next syllable pattern. Now he's mastered that, let's keep moving. Okay, so the percent mastery does tend to give you some useful information, but again, you need to interpret it in the context of what it is, and it's simply the student knew X% of the material. So again, with syllable types, the student was able to correctly read 30% of that syllable pattern. That's what that means, and again, it's very comparable to a classroom-based assessment where you might get, a score of 80% on your social studies test, which means you knew 80% of the material. So Criterion reference scores in that regard tend to be a little bit easier to understand, but when they're using things like pass-fail or proficiency, then that's a lot less useful information, right? So we know that the student is not proficient in X. What does that mean? How much lower than the criterion was he? How does that compare to other students his age? So always think about the kinds of information you're getting and the context in which you can use it. Okay. So norm-referenced assessments are a lot more complicated, but when we break it down, really can be very, there's parts of it that can be easily grasped and understood, and my goal for today's talk is that you can understand and interpret these scores so that you can better support the students that you're working with. So norm-referenced tests, first of all, the most basic score is a raw score, and the raw score is simply the number of items that a student got correct. However, that in and of itself is not a useful score, and it rarely even gets reported because you don't know how many items they were administered, so you don't have a percent mastery, and you can't compare that across different students or even across different tests. So the raw score is something that the test administrator calculates, but then that is used to calculate a bunch of scores that are called derived scores. So these are the scores that you're going to hear about and see in school-based assessment reports. So the derived scores include all of the things that are listed here on the screen, and we're going to break those down one by one. So the most important thing to understand about derived scores is that they're based on what's called the normal curve or the bell-shaped curve. Okay, so essentially all of these tests are statistically manipulated so that they have a mean score, an average score, and certain amount of variation around that score. So for most of the tests that we'll be talking about today, and for most of the tests that are given in schools, that mean score or average score is 100, and you see that right in the center here. So the average score is 100, and again, remember, that's not 100%, that's an average score. So if this test, in the norming group or when the test is given to thousands and thousands of kids, half of them are going to get 100 or better, and half of them are going to get 100 or less. And so again, it's a statistical manipulation to make these scores more easily understood, and for us to have that capability to compare students across groups. And what's really interesting to note about this, and I love this graphic because it's got the numbers in there for you, 68% of the population who would be given this test will fall somewhere between the scores of 85 and 115. 85 and 115 are in fact one standard deviation above and below that average score. Now, standard deviation is a little bit out of the scope of what we're going to talk about today, but think about it as variance or variation. So variation between scores is about 15%, or 15 points that can happen sort of by error or other reasons. And so if you're scoring more than one standard deviation above the mean, then you're in the point at which only about 13%, 13.5% of the population are going to score there. And if you score 130, which is 2 standard deviations above the mean, only about 2% are going to score there or better. And the same thing on the other side of the curve. If your score falls between 70 and 85, there's about 13.5% of students scoring along with you. But if you go even lower on the curve, 70 or below, only about 2% of the kids are scoring with you. Now, those are really rough because technically you'd be adding the 13 plus the 2, right? So if you're scoring above 115, it's really 15% that are with you. But between 115 and 130, 13% of the population score there. Why is that important? Well, I'm hoping, if I'm doing my job, it's becoming sort of obvious. It's important because if a kid gets a score right around 100, or really roughly in this area, they're scoring where most other kids their age score. But if they get a score below 85, they're scoring in an area that really only 15% of their peers are scoring there or lower. And so that's an important distinction for us to think about. Why are their scores low in this area, or why are their scores high in this area? So the kinds of scores that are derived from that normal curve that you'll see talked about a lot in school-based assessments are standard scores and scaled scores. They're 2 of the more common ones. We'll cover some other in a moment. So for standard scores, again, we talked about the average is 100. And so examples of that would be something like an IQ composite score. I'm going to come back to that, hold that thought. But sometimes you're also going to hear a scaled score, which has an average of 10. So that still lines up right there with the 100. So a scaled score happens on a subtest. A subtest is sort of, think about it as a mini test of very specific skills. So IQ tests are made up, you get an overall sort of full scale IQ score, and let's call it 100, okay? So solidly in the average range. But that 100 is derived from a number of different subtests. So there might be a verbal comprehension indexed, and on that index, there's a similarities subtest and a vocabulary subtest, maybe information or comprehension, but let's just focus on 2 subtests. So those subtests then are kind of averaged together with the statistical calculations that the tests do for the examiners, and then they get an index score or a composite score. So the little scores, the subtest scores, have an average of 10, and a standard deviation or sort of variation of 3. So again, quite roughly, anywhere between 7 and 13 could be considered average. And then the 10 correlates to the 100 on the standard score. So when you see the big scores, 100 is solidly average. When you see the little scores on the scaled scores or the subtests, then 10 is solidly average. The other scores that you'll see and hear a lot about in a school-based assessment are percentile ranks. Now, it's important that we differentiate this from percentile or percent mastery, right? A percentile rank orders the student's performance against those other students who took the test. Again, remember, we're still talking about our bell-shaped curve over here, our normal curve. So when a student gets that solidly average score of 100, they're at the 50th percentile. And what that means is their score is the same or higher than 50% of the kids who took the test. So that kid, if you lined up 100 kids in order of their test scores, that kid is standing at number 50 on the line. And that would be considered an average test score. This little graph is in here to sort of give you a prompt for where have you seen percentile ranks before? Well, if you've ever had a child and gone to the pediatrician, you know, they do their head circumference and their weight and their height, and they compare it on these growth charts, right? These are percentile ranks that you hear about on the growth chart. So again, when the student is scoring at 100, they're at the 50th percentile. But if they score up higher and they get maybe 115, then their percentile goes up. 75th percentile, if they're scoring at the 99th percentile, then that means that essentially they did as well or better than everyone else who took the test. So that's when you're getting into that little tail of the curve up here, right? Only 0.13% will do that. About 2% are going to fall around the 99th percentile. And if the student had done quite poorly on the test, let's say they're a student with a learning disability, the IQ scores were all average to above, but their reading score was low, you might see that reading score fall down here, you know, maybe between 85 and 70, and so their percentile rank is going to be 5% or 10%. So when you see a percentile rank that's in the really low range, in the single digits and in the lower 20s, then you can be pretty sure that you've got a concern going there as long as everything else is in a good place. Okay, the other score that you'll see a fair amount of and nobody ever explains, and for the most part, I think you can ignore this, but because you usually see it on the tables or the charts that get reported, I wanted to just make sure that you could understand these, and that is what's called a confidence interval. And the reason for the reporting of a confidence interval is because we know that when we give a student a test, there's a certain amount of error and variation. There's a certain amount of he was tired that day or not trying his best. And so what a confidence interval does is it gives us this sort of little statement that we're about 95% certain that this student's true score falls somewhere in this range. And so what's the true score and what's the range? The true score is if you hypothetically gave that student the test 100 times, then you could say his score is going to fall within this range. I have the fishing net here to sort of think of, you know, the scores like the net that hopefully you capture the true score for the student. And so it's important to think about, because if a student, you know, got a score of 85, the confidence interval, which is calculated again by statistics that are provided by the test, and that part is not that important. But to think about his score might fall somewhere between 70 and 90. Well, if on a different day his score was 90, that's a pretty different interpretation than if it's 70. So you do have to think a little bit about the confidence intervals if they're reported and what they mean. And I love this little Garfield example here. He says, taking a look at tomorrow's weather, and the weather forecasters on the TV is saying this, it continues on, the high temperature will be between 40 below 0 and 200 above. And Garfield's response is, this guy's never wrong. So if you cast a wide enough net, of course you can never be wrong, right? So what we try to do is narrow the opening of our net and give the best possible score that we can for a student. But if you've had a student given a test, or your child's been given a test, and you don't feel that the test truly captures what they know or can do, these are some of the questions that you can ask. The next type of score that sometimes gets reported, and interestingly and goodly, if that's a word, rarely kind of talked about in meetings, unless it's maybe brought up by a parent or somebody who's maybe less experienced with tests. But for the most part, I think a lot of people know that age equivalence and grade equivalence are not the best scores out there, but they don't really know why. So I want to help you understand that. And oftentimes I've seen these reports, these numbers reported like in the report, in the table of the results, but not really talked about. So again, if it's going to be on there, I want you to be able to interpret it and understand it. So age and grade equivalents are tricky because they can be very misleading. They shouldn't be used for decision making because of that. So what does a grade equivalent score mean? So if a second grader scores, let's say in reading comprehension, a grade equivalent of 5.0. Now anything after the decimal point means sort of what point in the grade they are. So if it was 5.0, they're at the beginning of 5th grade. If it's 5.10, they're at the very end of 5th grade. So if a second grader gets a score on a reading comprehension test that says they have a grade equivalent of 5.0, it doesn't mean that that second grader is reading at a 5th grade level. It sure looks that way, but it doesn't mean that. All it means is that second grader earned a raw score that's about the same as the average raw score of a 5th grader who took the test. So that's still good, right? They did well, but they probably weren't even administered 5th grade passages. So again, it's very misleading for you to think, oh, he's reading at a 5th grade level, or he can read 5th grade passages. It simply means on the items that he was administered, his raw score was about the same as the average raw score of a 5th grader. So no doubt that score is going to be above average, but it doesn't mean anything about the student being able to do or doing 5th grade work. The other caution about grade equivalent scores is that the growth of students slows down as they get older, right? So a difference in a grade equivalent at a young age versus at an older age, it might look, so there might be a student, so this student at a second grader, with a 5.0 grade equivalent looks like they are way ahead. And let's say we have an 8th grader at a 9th grade equivalent. They may be just as far ahead. It's just that the growth between 8th and 9th grade is significantly less than the growth between 2nd, 3rd, 4th grade, right? Because kids are just starting to read, so there's some explosions going on in things like reading comprehension, right? They're starting to switch from learning to read to reading to learn, and that comprehension is growing very quickly. So they're kind of truncated in a way that makes their interpretation even more difficult. So for the other example here, the age equivalents, same kinds of cautionary tales to go with that. A 9-year-old who scores who gets a raw score of 42 on a test, that might be an average raw score for 8-year-olds who took the test. So his age equivalent would be 8. But what does that mean? It doesn't mean he's a year behind his peers. It simply means that his score was a little bit closer to the score that 8-year-olds who took the test got. So if you see age and grade equivalents, I don't even report them in my reports, but if a parent or a teacher sees them, I just generally say disregard it. They can be quite misleading. So those were all of the kinds of scores that we have when we're talking about norm-referenced assessments. So the most important takeaway, I hope, from this segment of our talk is to think about understanding scores based on the normal curve. And the normal curve, remember, is a bit of a statistical manipulation. The tests are designed so that half of the population will score 50, or score at that 50th percentile. So half of the population are going to score around 100. 68% of those kids are going to be somewhere between 85 and 115. So it's a bit of a statistical manipulation, and I keep repeating that because I don't want you to think that it's an inherently meaningful thing, but it's done for the purpose of allowing us to compare scores across students, across districts, across states. So all of the students who took that test, that average score is going to be 100, okay? So those are standard scores. Percentile ranks, the average score is always going to be at the 50th percentile. So if the student scored at the 75th percentile, they're in the high average to above average range. And if they scored at the 25th percentile, they're in the low average to below average range. Now, why am I equivocating with the low average to high average? Different tests actually have slightly different cutoffs for those kinds of descriptors. So it's important that you, if it's not included in the report, that you ask if a score was considered to be below average or low average or above average. But those things should be in the reports. And again, if they're not, a rough estimate is going to be somewhere between 85 and 115 is roughly in the average range. Percentile ranks, again, the 50th percentile score is directly at the mean. Scaled scores are those little scores that come from mini tests or subtests from a lot of the tests. Like the IQ test, for example, will have scaled scores. They are very similar to the standard scores, except they're truncated on a smaller scale. So the average is 10. If a student had a scaled score of 10, the percentile rank would be 50. There's a variation of 3, so roughly, very roughly, between 7 and 13 could be considered average, but because it's so truncated, the argument is probably that 7 is going to be below average and 13 high average or above average. Anything above 13 would be above average. And then the confidence interval gives us that net, remember, to think about this child's true score, if given the test 100 more times, is going to fall somewhere within that confidence interval range. I chose, for example, between 90 and 110. That range is built around the student's own scores. So I think that scores are the hardest part to understand about these tests. So I encourage you to kind of go back and look at that. If you have a sample report, and we'll walk through an example later, but if you have a sample report to kind of look at and kind of quiz yourself, question yourself as you go, that can be helpful. But right now we're going to move on and talk about school-based assessment, tests for different purposes. Okay, so we talked about the kind of tests, the kinds of scores, and now the types of tests that are given. So there's different tests for different purposes, of course. One of the widely used tests in schools when we're doing eligibility determination for students with disabilities, educational disabilities, are going to be aptitude or ability tests, or IQ tests. They go by a number of different names. So aptitude test, ability test, IQ test. But essentially, these are going to test a general capacity to learn as best we know, right? Remember that none of these things are perfect. There's a number of different tests out on the market. We'll talk about them in a moment. But essentially, an ability test attempts to predict students' ability to succeed. It tries to measure such abilities as numerical reasoning, verbal reasoning, processing speed, memory. And so these are things that should, in theory, and in practice to a certain extent, help the kid be able to progress with his peers, right? So if verbal reasoning, numerical reasoning, processing speed, and memory are all within the average range, that child should be able to be progressing at an average rate. And if he or she is not, then you have areas of concern to look at. The reality is, however, most of us are not average in all of those skills. We all have our individual strengths and weaknesses. So it's important to look at overall scores as well as those individual sort of composite scores and subtest scores that we talked about before. These tests, aptitude, ability, IQ tests, are standardized, given in a very standard and prescribed way. They're norm referenced, so those scores that we just spent all that time talking about apply here. And they're individually administered for the vast majority. There are classroom-based tests, but the kinds of tests used for eligibility decision-making are individually administered. So the student is interacting individually with a qualified examiner. Commonly used IQ tests. Now, please note that this is not at all an exhaustive list. I just pulled out the ones that are used most in the school systems that I'm aware of. There certainly are others. But the Wechsler intelligence tests are very widely used, and there's a Wechsler preschool primary, Wechsler intelligence scale for children, and the Wechsler adult intelligence scale that can be given starting at age 16. So you'll often see a Wechsler IQ test. Another commonly used ones are Stanford Binet intelligence tests, currently on the 5th edition. I didn't put editions here because they do change regularly to keep up with the time. Differential abilities tests is something that's given more often for younger students, but again is one that you'll see. Woodcock-Johnson tests of cognitive ability, I also see used in the school systems a lot. And then there are a number of sort of more smaller tests or specialty tests, a number of nonverbal, and I kind of sometimes use air quotes when I talk about nonverbal tests because oftentimes there is still language happening between the two of you, but they're less what we call language loaded. And some of them actually can be given in pantomime, and the student just points to their answers. Some of them you're orally asking the student, and they can still point to their answers. So there's the comprehensive test of nonverbal intelligence. There's a test of nonverbal intelligence. There's a number of different nonverbal measures that are not terribly widely used, but are important for certain situations where you think that language is a factor. So for example, a student with an intellectual disability, especially a student with, for example, Down syndrome, language is one of their primary areas of weakness, and that's part of their disability. So to give an IQ test that's really testing language and processing speed, because that's another area of weakness for a lot of people with intellectual disabilities, particularly Down syndrome, is disadvantaging them. So you want to know what they know without further disadvantaging them for their disability. So there are absolutely times where nonverbal tests are a great choice to use. So these kinds of tests, aptitudes or ability tests, I sort of talk about as being forward-looking. They're typically trying to predict what a student should be able to do. Whereas achievement tests are typically sort of more backwards-looking in that they try to measure how well students have learned what they're expected to learn, right? So they're looking back at what the student has learned. So achievement tests, I break these down into two categories, wide range and specialized. You'll see that in a second. And that's important because a lot of times in school-based assessment, we're only giving the wide range test. But there are times when you really want to look deeper and give a specialty test or a content test. Wide range tests, achievement tests, do measure, they're sort of a measure of what's been taught. They allow you to compare student performance, and they do identify areas of strength and deficit. And by that I mean, you know, if a student has a standard score of 80, and again, we're going to look at some student scores in a few minutes, on nonsense word reading, and maybe 85 on word reading, but 105 on reading comprehension, that's telling us something, right? That's telling us, well, he's got good language skills and good understanding and probably a lot of really good background knowledge, so he's able to earn an average score in reading comprehension, but boy, his word reading and his reading decoding are kind of weak. We should look at this a little bit further. So it does allow you to identify areas of strength and weakness, and hopefully then to pursue those weaknesses further to better understand them. Commonly used achievement tests that I've seen a lot of in the schools, again, Wechsler's got a corner of the market here. So there's the Wechsler Individual Achievement Test, currently on its 3rd edition with the 4th edition coming out shortly. The Woodcock-Johnson tests of achievement I see quite widely used in the schools. Again, they have reading, math, writing, subtests. They have, you know, academic skills, academic fluency. So there's a lot of subtests on each of these measures that the examiners can choose to give. Kaufman tests of achievement are also not used quite as much, but I've seen a few of that, and Peabody individual achievement tests, again, some schools are using those. All fairly comparable tests. So I talk about those tests as wide range achievement tests, and so oftentimes in your school-based assessment you will see an IQ test and a wide range achievement test, and that might be all you see. And sometimes that's all you need. Maybe everything is average and the kid looks fine, or maybe there's some areas of deficit that get identified, but sometimes it's a little bit more nebulous and you're not sure where to go with that. So in the example of the student that I just talked about, who had a higher comprehension but poorer word recognition and poorer still decoding, I'm worried about that kid. I want to know why. Even though they were able to comprehend, again, I know how these passages tend to be fairly short and they can use their background knowledge. I tested a kid the other day, the passage was about basketball. It was kind of clear he hadn't read a lot of the words on the page accurately, but he could answer a majority of those questions about basketball based on his knowledge. So you really need to pay attention to differences in those test scores, and if that student's reading word identification and decoding skills were low, then I want to pull out a specialized content test and look at that more closely. So some of the commonly used specialized tests for reading, for example, would be the Gray oral reading tests. There's also the Gray diagnostic reading test and Woodcock reading diagnostic that aren't on here. Some of these are more widely used. The Pfeiffer assessment of reading is a relatively new test, but a very comprehensive look at reading. There's tests of word reading efficiency, which can be just a really nice, useful, quick measure of word reading efficiency and decoding efficiency, because again, we need to be aware of the fact of how well the student does on these tests, but also how automatic those skills are for him. And informal decoding inventory, one of the things I talked about before, is a Criterion reference. The rest of these are NormReferenced tests. In the area of phonological awareness, if we have concerns there, which for young readers who are struggling, we should look at this. There are tests like the comprehensive test of phonological awareness. It's actually comprehensive test of phonological processing. Excuse my error there, that's CTOP. There's the phonemic awareness screening tests. Not an awful lot of measures there, but two good ones, and there's some more coming out. With regard to math, there's things like the key math diagnostic test, the Pfeiffer assessment of math. Again, looking very much in depth at math, because you might find, for example, on your wide range achievement test that the student had average calculation, but below average math problem solving skills. So you might then choose to give a more specialized math test. So for example, both the key math and the Pfeiffer assessment of math look in depth at various parts of math. And so you might see, which was hinted at the wide range test, right? You might see that language, interpreting the language of math problems was hard for the student. Or you might see that they don't know when to employ what sort of operations, so they have procedural weaknesses. So it helps you identify more specifically an area of weakness. And then writing, if you're looking for a specialized writing test, because again, those wide range tests usually have, a sentence writing and an essay writing, or one or two subtests. So if you need a more in-depth test of writing, there is the test of written language, TOWEL, which is the 4th edition right now. There's the test of written test of written and expression, and oral and written expression. So there are a number of tests on the market that look at various aspects of students' writing skills to give you a more in-depth look at that. And then beyond sort of the academic look, oftentimes school-based assessments will do additional things. Not on here are observations. Almost always an observation in the classroom is conducted. Gathering social and information, medical, developmental information from parents. But in terms of additional tests that schools might use, depending on the referral questions, what we're concerned about for the student, they might give some rating scales to look at the student's social-emotional development or attention and attention and activity levels. So you might be giving something like a Connors Comprehensive Behavior Assessment or a behavior assessment for children. So the Connors or the BASC are what the abbreviations for those that you'll hear. Those look sort of broadly. If, sometimes the teacher says, well, I think, the student's very anxious, or the parent says, I'm concerned about my child's attention. those kinds of rating scales might be used and observations would be conducted. Sometimes in the case particularly of students with intellectual disabilities or suspected intellectual disabilities, you'll be looking at adaptive behavior. Adaptive behavior is how a student functions in his school and home environments, school, home, and social environments usually. And again, these are usually rating scales completed by home and school, looking at functional skills in a number of dimensions, like their communication skills, their social skills, their practical self-help skills. So that would be a measure of adaptive behavior. Commonly used tests there are things like the Vineland Adaptive Behavior Scales, the Adaptive Behavior System. There are a few of those. Memory and learning is often a part of a good assessment when we're testing students for learning disabilities, for example, but even with other areas of disabilities, it's very helpful to determine where their memory and learning strengths and weaknesses lie. It helps you better think about ways to intervene and accommodate for the student, and they do tend to sometimes be associated with various disabilities. So there are a number of sort of wide range and specialized memory and learning tests. So we might be looking at a test of memory and learning, or the wide range assessment of memory and learning, TOML and RAML, and they're looking at visual, verbal, learning over repeated trials, what their learning strategies are. Or you might choose to give just a visual test or just an auditory test to sort of look at those areas a little bit more in depth. Sometimes some kinds of neuropsychological tests are given. So no, I'm not talking about going to the neuropsychologist for a full neuropsychological workup, but there are some tests that school psychologists and private psychologists have access to that can look at students' sustained auditory attention or concentration. They can look at their fluency of word retrieval, of rapid naming. Those are all areas that correlate with various learning disabilities such as dyslexia that we may, and ADHD, that we may want to look at further. So those are other areas that you'll sometimes see assessed. And of course, outside of the realm of the psychologist, but equally important for school-based assessments, you'll see speech-language testing done by the speech-language pathologist, if that's a relevant area, which I would argue for young children struggling with reading would almost always be a relevant area to at least look at. You might see tests of fine motor given by an occupational therapist, and you might see tests of gross motor given by a physical therapist. But again, those tests are going to be brought in, and those specialists are going to be brought in if and when it's part of the referral question. So teacher says handwriting is poor, or parent says still can't zip a zipper, or child is observed to be clumsy, or whatever, you know, when those problems are part of the referral problem, then those specialists are called in and they give their specialized tests. Okay, so we're going to try to apply our knowledge now. And you'll see I highlighted the word reading subtest because that's the subtest that I want to talk about with you today. But I put the whole printout here because I wanted you to see this is the kind of table you'll often see in a school-based report. You'll see I have the caution sign over the grade equivalent and age equivalent. Hopefully you know why, but we'll talk about it. So here's a student. The student was in the 3rd grade. And you see that her word reading standard score was 88. What does that mean? So remember, a standard score of 100 is average. So 88 is below 100. It's not a full standard deviation below. It's actually just above. So 85 and below would be even lower. But 88, when I see these other scores, is a little bit concerning for me for this student. You see that their confidence interval, and this time it's a 90% confidence interval that's been reported. The confidence interval for this student's reading score, it was 88, but we are 90% certain that if we gave that child this test a bunch more times, the score will always fall somewhere between 84 and 92. The student's percentile rank is 21. Now, let's look at these. Okay, so her grade equivalent was 2.0. This is a 3rd grader. So you could look at that and say, oh no, she's a full year behind in her reading. Not necessarily true, right? What do we know about that grade equivalent of 2.0? It means that her raw score, or basically the number of words she was able to read, was the same or similar to the average raw score of a second grader. In this we see 2.0, so it's a beginning second grader, and this was a student mid third grade when she was tested. Okay, so based on this alone, you know, you could say, she's just about in the average range, I guess she's fine. But if you look at the whole picture here, I hope you're asking yourself some questions. One important thing is to look at her listening comprehension compared to her reading comprehension. So when this child heard passages and stories and conversations read to her, she scored at the 81st percentile, the same or higher than 81% of kids her age. But when she had to read the story herself and then answer comprehension questions, her percentile rank falls to an 18% and her score to an 86. So now we're concerned. We're saying, why is her reading comprehension so much poorer than her listening comprehension, right? Picture the Scarborough's rope. She's got the language skills. She's got the ability to comprehend information if it's given to her orally. When she has to read it, we have a problem. And so even though in isolation our word reading score of 88 is not hugely concerning, when we look at it in the context of these other things, and when we look at she's got average to high average math skills, she's got pseudo word decoding, so her nonsense word reading is very low. It's at the 4th percentile compared to other kids her age. Now we're getting concerned. So based on this table, my recommendation would be, wow, we need to really look more closely at this student's decoding and word reading skills to see if we can figure out what's going on. And again, caution, ignore your grade equivalent and age equivalent scores. So I hope that this helped you get a basis for understanding the kinds of reports and scores and tables that you're going to see as a teacher or a parent when student or child has been assessed. Thank you for your time.